let's get started. As I mentioned on my previous video, there is no single test to diagnose lupus. You have to go through a series of tests. In fact, the National Lupus Foundation says that it's really a criteria of 11 kind of symptoms and points that the doctor kind of looks at to kind of gauge the aggressiveness of your lupus. And they basically believe that, or they basically state that you have to meet 4 out of the 11 criteria to be diagnosed or classified as someone living with lupus, thus bringing on more and more problems when it comes to treating such a complicated disease. Treatment for lupus varies due to the wide range of complications that are suffered by people with lupus, and also the different factors that affect lupus, the disease itself. You have age, stress, hot and cold temperatures. You have even simple things that you can eat can literally cause your body to respond like allergic reaction and have what we call in the medical community a flare. And when a disease, or in the instance for lupus, when it's flaring, means that our lupus disease or our antibodies are at an all-time high in our body, and it's attacking an area at a real damaging rate. For instance, when you can have a flare and your kidneys can be attacked, and it makes your kidneys leak protein. Some people flare and it causes your lesions to spread, change color, to swell. You also can have a flare and it causes swelling in your chest that cause pressure for some people, and it causes them to have strokes, heart attacks. We also have people who mention signs and symptoms of lung problems, heavy breathing, weight fluctuation, and all of these are things that doctors have to treat when it comes to dealing with somebody who has lupus. People living with lupus have 2 types of specialists that they really see to help control their treatment. If you suffer from discoid lupus or cutaneous lupus, which is basically lupus of the skin, you see a dermatologist, which is a doctor who specializes in skin and beauty and basically the treatment of our outer extremities like our hair, our nails. The number 1 common treatment for it is just applying sunscreen every day. Most doctors suggest that if you have any type of lupus, that you should supply sunscreen as high as SPF 70 daily, just as a protective barrier between our body and the sun. And then if you have SLE or systematic lupus and other forms of lupus, you're treated by a rheumatologist. And a rheumatologist is a doctor that deals with diseases classified under rheumatoid arthritis. And basically what that means is they deal with a lot of diseases that, like fibromyalgia, that has a lot of the same symptoms as lupus, like joint pains. However, they are able to generalize and specialize what we need as lupus patients better than your primary care physician or just a family's pediatrician if your child is living with lupus. According to the Lupus Foundation of America, only 1 out of 10 patients with discoid lupus would develop SLE lupus. However, 70% of all people who live with lupus have SLE lupus. And SLE is one of the hardest forms of lupus to treat because, like I stated in my last video, it's so many symptoms. So it's basically a hit and miss, a trial and error, and your doctors and you have to work together as a team to get the job done. So I thank you again for tuning into my video blogs, and feel free to follow us at First Coast Lupus Fight. And always remember to be bold, to be beautiful, but be exactly who you were created to be. God bless you.